Hi Connor, my name is Dr. Peyton Goldthwait. My team and I were assigned to your case in order to diagnose your ailment. What we found is that you suffered from something called a transient ischemic attack, also known as a TIA. Dr. Oxford had suggested this might be possible earlier, and my team and I have confirmed it. A TIA is basically a mini stroke, and it happens when a blood clot restricts blood flow to the brain. They are also a warning for a future stroke, which is why we need to treat it right away. Even though the symptoms of a TIA pass pretty quickly, you will need treatment to prevent any future attacks. To make sure this does not happen again, I can prescribe you with a medication that will prevent blood clots. The first is an antiplatelet medication. Platelets are basically blood cells that help the blood to clot and thicken. This medication will work to reduce the ability of platelets to stick together, thus reducing the chance of having a blood clot. This is one of the more common recommendations, so I would definitely recommend this. And the side effects may include indigestion and an increased risk of bleeding. For example, if you cut yourself, you'll just bleed longer, or you will also bruise pretty quickly. The second medicine is an anticoagulant, which helps prevent blood clots by changing the chemical composition of your blood in order to prevent them. I would not suggest this one for you since your blood clot did not originate in your heart. And we know this because your echocardiogram came back normal. A side effect of an anticoagulant is increased bleeding. A third treatment option would be the antihypertensive, which is for people with high blood pressure. This would regulate your blood pressure, and it is good for preventing a TIA since high blood pressure can significantly increase your chances of having one. I would not recommend this for you since you have a normal blood pressure. Having a TIA will not have any impacts on your day-to-day life. However, there are some things you can change to help prevent one. For example, you should make sure you're eating a balanced diet. That means low fat, reduced sodium, high fiber diet with lots of fruits and vegetables. Make sure you're also exercising regularly. I would recommend at least 2.5 hours of good exercise a week. You will, however, need to stop driving for a month, or at least until I clear you. And once you are cleared, you must inform your insurance company, so either you or your parents can do that. If you stick to these things and stay on top of your medication, you shouldn't have any problems. Make sure you come back and see me if you have any weird side effects or if you have another episode. Have a good day and thank you for your cooperation.